I'm Dr. Melanie, and here to talk about hormones, which, looks like mostly women in here today. We all have had some issue along the way, or just maybe interested in keeping a balance. So, the biggest point I want to make is just how everything is so connected, because sometimes, even just your thyroid might get blamed on something, or estrogen, just one thing, but it's not really one thing. Usually you want to look at the connections between everything. So I just wanted to make that point today, and then go over a few ways you can help with some natural remedies, diet, and some possible hormone replacement therapies. In my practice, I have a mix of people that come in. I have some people that come and they're like, yeah, definitely, I want to do hormone replacement therapy. And I have some that don't want to. And so we have other ways we can help with hormonal symptoms besides the replacement therapy. So just a little bit about me. I've been in practice since 2011. I did start in engineering, believe it or not, and then I had a lot of health issues myself, and went to a naturopathic doctor in East Southern California, and he helped me, and decided to go back to school and move back to Indiana. So I'm in Indianapolis, for those of you not here. And then I also went through a lot of health challenges that the naturopathic doctor was able to help me with. So I felt strongly about changing careers to go in that. And then with my engineering degree, it does help with like problem solving with people with health issues, like trying to figure those out. I do have a supervising physician, Dr. Nall. He's a DO, so that allows me to write scripts like for hormones and thyroid and peptide therapy, as well as do lab orders for people who use their insurance. So just a little quick overview here. These are all the organs and parts of our body that are involved in the endocrine system. So that's what I mean when it can be very complicated, and you really want to look at the whole picture. So we have, most people have heard of adrenals, your thyroid, even the parathyroid. We have some messaging with pituitary and hypothalamus in our brain and pineal gland. The pancreas, as far as like the blood sugar, and then ovaries, testes for females and males there. So, and that's why I make the point. And it literally is like an orchestra with everything working together. So we'll talk about that a little bit more. Adrenal glands, again, the stress glands. So most people have heard of those. They sit on top of your kidneys, make cortisol, DHEA, norepinephrine, epinephrine. Most people think of those stress, energy, fluid balance, with like water retention, things like that. But they also play a big part with your immune system, balancing your blood sugar, inflammation control, and your hormone production. And I'll touch on that a little bit later too. So because there is such a correlation with the blood sugar and your hormones, and there is a direct correlation between cortisol and insulin, it is important to eat to stabilize your blood sugar. And I would say, this is, some read this, it's like, oh, okay, duh. But I think it's a good point to just keep, in the back of your mind anytime you're eating, to always eat to stabilize your blood sugar. So, if you're going to have carrots, that's definitely healthy, maybe eating hummus with them or some nuts. So anytime eating like carbs, even healthy carbs, if we try to eat some protein or good fat with that, it just really helps stabilize the blood sugar. And that in turn will help the rest of our hormones, keep cortisol very level too. And then does also impact our other sex hormones too, because of the impact of our adrenals and the pancreas with the blood sugar. So, ideally, and I know some people do well fasting, in the morning, and, everybody's different. This is kind of general. And I would say most people that come in initially when they have hormone issues are not going to generally feel better being fasting, doing long periods of fast. So this is kind of general rule, especially adrenals eating before 10 a.m., especially something with protein. And then in addition to diet, manage stress. It's like, who doesn't have stress? But really finding something that you love to do. So that helps, with your stress, but also makes you happy. And that can make a big difference because, with the exercise too, if you really don't like doing it, yeah, maybe you have the willpower to do it, but it's definitely not as enjoyable. So trying to find something that you do like to do and making sure you're getting your sleep. Well, we could talk all day about sleep hygiene, but not staying up late watching TV and electronics and just making sure you're giving your body time to rest will help too. And then this is just how the female hormones are affected by adrenal fatigue. So we're going to talk more about the estrogen, progesterone, testosterone, but when your adrenals are having issues, you could also have night sweats with elevated cortisol and hot flashes. So again, if someone's thinking like, oh, this is my estrogen, it might have to do with your adrenals. So there's, a lot of things going on there. The one thing I don't have there, but elevated cortisol also will cause insomnia. Usually it's a 2 to 3 a.m. wake up if it's elevated cortisol at night. So that can be a sign. And then with the low cortisol, you could have increased menopausal symptoms too. Additionally, does cause PMS sometimes too. I do see with low cortisol too, people will say, man, I'm really having heavy bleeding, but it stops on day 4 and then starts up again a few days later. That is usually like a low cortisol. And these slides, if you guys would like them as a PDF format, we're happy to email them because I know there's a lot of information to go through on this time. And this is being recorded as well, so we can send that to you. So thyroid, most people will think of that as energy, weight, which it does help with that, but also helps a lot with other things that we don't think about, even regulating like our cholesterol. It really helps strengthen our bones. And then if you don't have enough thyroid hormone, the body cannot make enough progesterone. So there we go, the impact with the other hormones. And if your estrogen is increased, meaning estrogen dominant compared to progesterone, that can decrease the thyroid hormones, kind of put a stress on the thyroid. So again, they're kind of all just need to be balanced. Underactive thyroid, that's the main thing we see. Overactive thyroid is not as common. So hypo, meaning underactive. You could also see hot flashes and night sweats, affect the menstrual bleeding. Then, again, a lot of things also that people don't think about, like hair loss, just irritability. But also you could see an elevated cholesterol level with not enough thyroid hormones. So it does help with the cholesterol get into the cell. So the overactive is going to be more anxiety, hyperactivity, nervousness. It's not as common. And just to touch a little bit on cholesterol, because I have this happen a lot in my practice. It does play a big part in helping us make our sex hormones and our adrenal hormones. And it helps transport those hormones to the correct sites. And so if you don't have enough cholesterol, that's going to impact your hormones. So, sometimes like if someone's super low cholesterol, we can do like omega-3s. I think I touched on that a little bit, just get more of the healthy fats in the diet. And then if your cholesterol is high, that means you don't have enough hormones in the cells since they're kind of helping each other with that transportation there. So, I do see women, peri-menopause, menopausal, sometimes cholesterol will go up, in their labs. And even also your insulin could go up, like blood sugar. The cholesterol, is because the body is like saying, hey, I need to make some more hormones. I don't have enough. So that is not unusual to see. And then once kind of the, either if we're doing hormone replacement therapy or doing other ways to kind of support the adrenals to help the hormones, then we may see that come back down. So it's kind of important to know that, of course, taking into account, family history, cardiovascular, and all that, but being careful with lowering your cholesterol, without finding out, why is it going up? Is it hormones? Is it something else? Fiber and essential fatty acids, getting those good fats in your diet, especially omega-3s. So like salmon, sardines, anchovies, which I know some people are like, okay, I don't like those. Hemp hearts are also a really good source of omega-3s, so you can get them other ways. Chia seeds, and then the fiber, of course, is important too to help with elevated cholesterol. Low cholesterol, so this would be where we would say, again, focusing on those good fats. So we want to make sure the hormones could get transported with the cholesterol. So there is that tie in there with that in your hormones. As far as the main hormones of the ovaries, which again, most people have heard, estrogen, progesterone, testosterone, but estrogens, there's actually three different ones: estradiol, estrone, and estriol. These all work together to create a balance. So we also want to make sure we're looking at all these and not just checking someone's estrogen. So low estrogen, because of what we just talked about with the cholesterol, will impact that. We could also see, the hot flashes, night sweats, vaginal dryness, insomnia, insulin resistance. So again, the blood sugar will be impacted because of that correlation in cortisol and insulin, and the pancreas too, as being part of your endocrine system. So keeping the blood sugar stable is really important. If you have too much estrogen, and PMS could be worse. So as I mentioned, it can impact the thyroid. We do see more of like other issues like the headaches, maybe some fibroids. I would say most of the time, if someone has uterine fibroids, they've got some extra estrogen, and sometimes that might not even show up on labs, because it can be some of the estrogens in our environment, like the chemicals that mimic those. So those, I do check those sometimes too, if we can't quite figure out like what it is, but it is almost always a estrogen dominance problem. And then progesterone, this is more kind of our calming hormone. So a lot of times if you've got low progesterone, you are going to have trouble with sleep, anxiety, just mood stuff. And in looking at the balance of the hormones, example, if you've got extra estrogen, your progesterone's low, this is where we're going to see like possibly painful breasts, the weight issues, because those we need the balance of those two. So heavy periods, estrogen is the one that helps the lining of the uterus to build up. Progesterone is the one that will help it slough off and keep it, thin. So that's where we might see more heavy periods. High progesterone, I don't see that very often, to be honest. It's not as common, and I don't know exactly why that is, except probably most of the chemicals in our environment are going to impact more the estrogens and the progesterone. In other words, cause some high estrogen instead of high progesterone. So that's one theory, but that's not as common. So excess testosterone, many people have heard of like PCOS, polycystic ovarian syndrome, and that can be from too much testosterone, and and that can cause acne, the blood sugar issues. Sometimes we'll have ovarian cysts with the PCOS. So regular periods for sure. Sometimes they won't have a period for long periods of time. And then that one also, usually people will see some excessive facial hair, low testosterone, fatigue, depression, also like muscle wasting, like not being able to build enough muscle. We do see like the hair loss, maybe skin not looking as good. So testosterone, I know it's, we're talking in particular for women in this presentation, and we always think testosterone for men, but it does play a part in women's health too. So it does help us. So, and then how the hormones are affected by menopause, the main ones, which I mentioned, and not just menopause, I would say like hormone decline. So it could be perimenopause as well. But estradiol, which is E2, that's our strongest estrogen before menopause. And then once we go through menopause, that one is almost non-existent. So again, that one I said, that one kind of stimulates tissue more. And then estrone, that's the main one that we produce kind of after menopause. And you can convert some of that, into supportive estrogen too, like after menopause. And that is also produced by the adrenal gland. So that's where I was saying, like, if someone's like, hey, I really don't want to do replacement therapy, we really focus on, hey, let's get, obviously your liver, because that will help your hormones metabolize them, but support those adrenals and the fats, and support you that way. Estriol, which is E3, protects the vaginal lining, and it's a very mild form of estrogen. So that one, may use, it works very well for like vaginal dryness, postmenopausal, and doesn't have the stimulatory effect as estradiol. So it's very safe to use. Progesterone, as I mentioned, more calming hormone, whereas, and I should say, like, I think I go into this more about the protective benefits of hormones, but estrogen does give us protection, cardiovascular bone health. Progesterone is helping more kind of brain, like sleep, recovery. And it is also made by the ovaries before menopause, adrenal glands after. So again, there's those adrenals. We got to take care of those. If you have excess cortisol, that's going to impact your progesterone. So paying attention to that, and then helps our thyroid and our blood sugar. Testosterone is also made by the adrenals after menopause, and then a small amount is made by fat tissue after menopause. So that supports energy, mood, libido, things we match. And sometimes people do really well with DHEA. This is a hormone that is made by your adrenals, and downstream it'll support estrogen and testosterone. So that's also a way to kind of support you if you're having some decline in your hormones. And that's over the counter. That doesn't require script, the DHEA. As far as menopause, some of these symptoms we already talked about with like the hormones declining. So these would be kind of the more common ones we see. One thing I should add on here that I should have is also pain. I do see sometimes once women go on hormone replacement therapy or supporting the adrenals, however we go about supporting hormones, their pain that they're having will go away. So that can be a symptom to have more aches and pains with the hormones declining. Some other things that may help would be, since we know how much work the adrenals can do with the hormones, would be doing some adaptogenic herbs. So like maca is a good one, holy basil, and those are pretty safe. They also, since they are adaptogenic, it kind of helps, like if you're tired, it helps if you can't sleep or stress, they kind of just adapt what your body needs. So those can be really helpful. Rhubarb root extract there is a supplement by Metagenics called Estraveris. So it's literally rhubarb root. That works really well for someone having hot flashes. It can help a little bit with vaginal dryness too. So that's just an herbal way to go about it. And these, the herbals and stuff, you don't have to worry so much like, oh, Estraveris, since that's helping a little bit hot flashes and vaginal dryness, does that mean I need to is that going to increase my estrogen? No, that's not going to do that. So you don't have to worry as much about keeping the estrogen progesterone ratio there. 5-HTP, that is an amino acid that helps your body make serotonin. That can help really well too if someone's having like sleep disturbance, mood issues, hot flashes. And if people can tolerate melatonin, it's good to do with the melatonin for that reason, because your body will make 5-HTP into serotonin, then serotonin helps melatonin. So you're kind of hitting that whole pathway there. So those are both really helpful. Phosphatidylserine, this is a fat attached to an amino acid. And it works really well when someone has like high cortisol. So if you've got that 2 to 3 a.m. wake up or hot flashes when you wake up at that time, sometimes that might be helpful. It can be taken during the day too, not just at night if you feel very stressed during the day. And it works really well at lowering cortisol. Sometimes with that product, I just have to have people do like 1 bottle of it and it'll kind of reset your adrenals. But it can be taken long term too. Then amino acids, if we go back to kind of what I mentioned about diet and making sure you get enough protein, that's going to be a good source of your amino acids, but you can also take those as a supplement. So they're building blocks for everything in the body. So in addition to getting like your good fats and omega-3s, cholesterol helping hormones, amino acids could be another way to support you, protecting like the skin and bones and that could be another way, but also making sure you're getting enough protein. I mean, you can do it through diet for sure. This takes, a little work. I don't really recommend super high protein diets for people. Most people, I think a normal amount, like as long as you're eating protein each meal, I think like, depending on what you're doing, but like somewhere between like 80 and 100, never above 100. If you're like perimenopausal, again, menopausal stage, younger, I mean, you might be 60, 80, somewhere in there. And again, everybody's different. Those are just general terms. The other thing I have a really good success with is collagen. There's a whole body collagen that I use that works really well in helping with the vaginal dryness. And obviously it like helps hair, skin, nails, and your joint or bones as well, because it's whole body collagen. There are different forms of collagen for different parts of your body. So that also I have a really good success with too, in helping different issues. And then some of my patients say like lavender, clary sage. Lavender, it's a very calming oil. Most people know that. So that might help with sleep stress. Clary sage, more hormone kind of symptoms like hot flashes, night sweats, and those can be diffused or you just put them on topically at night. So you have a couple different ways you could use those, and they smell good. So and then if someone does decide to go and do some hormone replacement therapy, which I can offer as well, these are some of the benefits. I've mentioned already some. There's been a lot of debate over the years in hormone replacement therapy with women, and it has finally been refuted, thankfully, because of the study that was done that started in 1999. They have came out since and said that the study was flawed and wasn't really reliable. It wasn't using bioidentical hormones either. So fortunately, now more women are more comfortable, even, with me or their doctors talking about hormone replacement therapy as a protective measure. And also just to feel better. If you're not sleeping, it's kind of makes everything not right. So that there's all kinds of, there's a really good book that I read on that. There's two books that I recommend for people that kind of explain that if you're still uncomfortable. And it's a personal choice for sure. But that at least the newer research has shown for most women, again, everybody's different, depends history, all of that. Starting hormone replacement therapy younger than later has more protective benefits, and outweighs any risk. And the big thing is people always wonder about like cancer, because of the study in 1999 that has since been refuted. Again, they were using synthetic hormones, but, as far as what's causing the cancer in your body is not the hormone replacement therapy, but if you have cancer in your body, the hormones might make it grow because it's hormones. So if you're on those, and you do develop some sort of cancer, you stop and deal with that, and you can go back on them. And even a lot of oncologists are doing that now for women with breast cancer. And again, depends on genetics and history. It's not broad terms, but just to make people feel a little bit more comfortable with it. So we do have, with hormone replacement therapy, estradiol, estradiol's options, and there are different forms. And some of these can be, you can use your insurance, like estradiol. There is a bioidentical, even some patches for women. And then the progesterone, there is a capsule that's bioidentical that you can get through just your regular, insurance pharmacy. Testosterone, there's not really a good option for women. Unfortunately, it's, the gel they have, it's the strength, it's very hard for women to use. So that's usually is compounded right now. And I use compounding pharmacies a lot because, as an example, if I'm putting someone on testosterone and estrogen, I can combine them and it's one cream instead of like doing two different things. And then progesterone, I have more options that I can do through compounding pharmacies, creams, lozenges, or troches. So, we can do pretty much anything that makes life easier for people, and based on like age and your hormone levels. And I should say the bioidentical, if you don't know, that just means it's chemically the same as what your body makes. So it kind of knows what to do with it versus the synthetics. So this is kind of basic, like labs I would check. We could, of course, add on other things if things going on. But looking at the adrenal hormones, full thyroid panel, thyroid antibodies for autoimmune thyroid problems. So we could catch that early if that was a problem. Autoimmune thyroid can be reversed. So it doesn't mean, you have to be stuck with that autoimmunity. And if somebody's having normal cycles, like you're still menstruating, then we have you go day 19, 20, or 21 of your cycle to get the best balance of the hormones. Regular cycles, you go any day, postmenopausal any day. And I usually will do estradiol, progesterone, testosterone, binding globulin, and a free testosterone, like Unbound, as a minimum. And then having like a recent CMP, like your kidney liver function, your blood counts, lipids. So we see that cholesterol piece relationship, a blood sugar. We'll see a glucose in your CMP, but hemoglobin A1C is a great marker for seeing like your blood sugar average over a 3-month period. And then vitamin D, of course, I think everyone should check that, like winter and summer. And then iron panel with a ferritin, which is your iron store, and a B12. So that's, again, kind of basic, but it can get a lot deeper if we need to look at other stuff, like some inflammation markers. Sometimes I'll check. And even just like with your lipids, going a little bit deeper if that's a problem, like some oxidized LDLs and things like that normally aren't looked at. So that's pretty much it, kind of overview there. We do have, if this, again, we can email you guys out a PDF for the presentation, because if you are not currently a patient, you can scan this and it just ask you for like your name, email, so we know who filled it out, that you get $50 off your first appointment. So, and that's through the end of the year. You could, and I'd be fine if you shared that with someone, if you know someone that might be interested. And then I do also do discovery calls. They're $25. It's 15 minutes. And that's, if you book new patient appointment after that, you get that $25 towards that appointment. So if you're not sure, and I do also accept health savings accounts, for the appointments. And from our website, the dragonfly360.net, you can book an appointment. At the top, it says book appointment. You'll see all our appointment, and pricing is all on there and everything. And I would say for me, mostly I'm focusing on gut issues, allergies, the hormones, meaning sex hormones, thyroid, adrenals. Those are like my main areas of focus, in allergies. But I see anything from, skin issues to autoimmune, like anything with chronic health issues trying to find that root cause, so people feel better. So that's kind of the basis of my practice. And I would say I use like a combination of nutrition and supplements and some scripts if needed. So, but I really appreciate you joining. We will make sure you get emailed out a PDF of the slides. So I know there's a lot on some of those. I didn't read them all. And also, once we have the recording, we'll share that with you as well. And then let me see if I had any questions here. Let's see in the chat. Doesn't look like anybody had anything. So you can always email to the info@dragonfly360.net. And we're happy to answer questions after the fact if you've thought of anything. But again, I really appreciate your time, and I hope you guys have a great weekend.